Hey there, and welcome. If you or someone you care about is looking into radiation therapy for skin cancer, you've come to the right place. We've put this guide together to walk you through everything, step by step, so you know exactly what's coming. Okay, let's get right into it. Let's start with the most important thing you need to hear. Radiation therapy is a safe, non-invasive, and seriously effective treatment for skin cancer. Our whole goal here is to swap out any uncertainty you might be feeling with clear, straightforward information. Because, understanding this powerful tool is really the first step to feeling confident about your treatment plan. So, we've broken this down into four main parts. First, we'll get into why this treatment is even chosen. Then, we'll walk through the process itself. After that, we're going to tackle the most common question: what happens to your skin? And we'll wrap up with the healing journey and long-term care. So, first things first, why radiation therapy? Well, there are some very specific reasons your care team might suggest this path, and honestly, it's often an excellent choice depending on the situation. What's really remarkable is just how versatile this treatment is. It's often the go-to for common skin cancers like basal or squamous cell carcinoma, especially in those delicate areas like the face, nose, or ears where surgery could get pretty complex. But it's also a crucial option when surgery just isn't on the table, or maybe when a previous surgery didn't quite get all the cancer, or even if a cancer has come back. It's also used for certain cases of melanoma and for cutaneous lymphomas too. So how does it actually work? Well, the science behind it is pretty brilliant and straightforward. It's a process called external beam radiation. Basically, the technology uses these highly focused beams of energy, either X-rays or electrons, to target the cancer cells. This energy damages the DNA inside those specific cells, which stops them from growing and dividing. And then your body's own amazing healing process kicks in, clearing away those damaged cells and replacing them with new, healthy ones. Okay, let's move on and see how all of this gets built into your actual treatment plan. We're going to break down exactly what happens, from your very first planning appointment all the way to your daily sessions, so there are absolutely no surprises. Your treatment journey starts with this really important planning session called a simulation. This is where your team uses imaging, maybe a CT scan, to create a super precise map of the treatment area. Now, to make sure you're in the exact same position every single time, they might create a custom, comfortable mold or even a mask just for you. Then they'll place little ink marks, sometimes tiny permanent dots, on your skin. These aren't just for show, they're like guideposts for the radiation therapists. From there, you'll start your daily treatments, which are usually short sessions, Monday through Friday, for a few weeks. And I really need to emphasize this next point because it's so important. The treatment itself is completely painless. The machine will move around you, but it never actually touches you. You won't see a thing, you won't feel the radiation at all, and each session is fast. We're talking 15 to 30 minutes, and you can head right back to your normal daily life right after. Okay, now for the part everybody asks about. What is going to happen to my skin? Look, it's really important to know that skin reactions are expected. They only happen right in the treated area, and they show up gradually, so let's look at a typical timeline. The skin's reaction really happens in stages. For the first couple of weeks, you might just notice the skin looks a little pink and feels dry, kind of like a mild sunburn. Then, as you get into weeks 3 and 4, that reaction gets a bit more noticeable. The skin can get redder, feel tender, maybe a little itchy. You might even see some hair loss right in that specific spot. Then, if your treatment goes on, the reaction usually hits its peak between weeks 5 and 7. At this point, the skin can get bright red, and it might even start to peel or feel moist. This is all a normal part of the process, and your team is going to be guiding you on how to manage it every single step of the way. Once your treatments are all done, your body's healing process really kicks into high gear. So this last section is all about your recovery and how you can give your skin the best possible care as it gets back to normal. The healing journey follows a pretty predictable path too. In the first 1 to 3 weeks after your last session, that redness will start to fade as fresh new skin comes in. Over the next month or two, your skin's color and texture will gradually go back to normal. And long-term, you might notice some slight changes in pigmentation. The area could be a bit lighter or darker, and it will definitely be more sensitive to the sun, which makes sunscreen an absolute must. Caring for your skin during and after all this is simple, but it is so important. Stick with gentle, unscented soaps. When you dry the area, just pat it gently, never ever rub. Use whatever moisturizers your team prescribes, exactly like they tell you to. You'll also need to avoid putting anything else on the area, like perfumes or lotions, and no shaving there either. And like we just said, protecting that skin from the sun is absolutely key. So with all this information, you're probably wondering, Okay, so when is it time to actually pick up the phone and call the clinic?
Your care team is always there for you, but you should call them immediately if you experience any of these things: a sudden increase in pain or burning, any blisters or open wounds, bleeding that won't stop, a fever, or any changes in your vision if the treatment was near your eyes. Basically, if any symptom gets worse out of the blue, they want to hear from you.
So let's end this by focusing on the outcome. The vast majority of patients heal completely, they get excellent cosmetic results, and they often don't need any further treatment. It's a highly effective, super targeted therapy designed to get you back to your life feeling healthy and confident. We really hope this explainer has helped clear up the journey ahead for you.